go. Okay, my name is Josh, and I'm gonna do my head to toe assessment today on my mom, Sharon. My sister Ashley is working the camera work. Okay, we're gonna start out by introducing myself. I'm gonna be your nurse. I'm gonna do your head to toe assessment. We're gonna provide privacy. We're gonna provide proper lighting, and I have all my equipment on me at all times. Okay. Now I know that I'm being a male, that this may be a little uncomfortable, so we're gonna give the option to have a female to come in and do the assessment instead of a male if that makes it more comfortable for you. Okay. All right. I'm gonna start out with I'll start out taking out your blood pressure. I'll get your blood pressure, temperature, pulse, and check your respirations. Okay. After that, I'd ask you if you had any pre-existing medical condition.
I have high blood pressure and I have irritable bowel syndrome.
Okay. And then after that, I would during this interaction time, I'd be able to check out her level of consciousness or orientation, her affect, her mood, her speech pattern, and articulation. And then while I'm just generally talking to her, I can check out her hygiene, her clothing, if it's appropriate for the season, if it's appropriate for age, if she's more disheveled or meticulously kept up, and her actual nutrition, if she's well nourished or undernourished, things like that. Okay, if I could get you to walk from this hall or this corner to over here. Go ahead, and as she's walking, I can check out her gait, her posture, her coordination of movements. She doesn't use any assistive devices. No involuntary movements are noted. And while you're up, if I can get you to raise and put one shin and rub it down the other shin. This tests cranial nerve number 7. Okay, good job. And strong gait was noted. You would notice any kind of decoordination or deviation to one side or the other that may show some signs of a neuro impairment. Okay. All right. From here, we're going to go straight into the actual exam, where I look at her. I'll start out with her head. We're going to notice her scalp and her hairline. Thin hair is noted, but that's a long history of. If it was just a new onset, maybe poor diet or nutrition. But at the current time, it's just baseline. We're going to notice some sun areas on her forehead and some up here. You can use this as a time for education. With her skin complexion and her age, she may need to start wearing some more sunscreen and wearing a hat more often to keep from getting cancerous lesions and stuff. Okay? Alright, from here we're going to go to the eyeballs actually. We want to first note the actual physical structures on the outside, the cornea, the conjunctiva, the sclera, and the iris. And to get the best view of them, we're going to let you look straight ahead. Mm-hmm. I'm going to hold down, and if you'll look up, you would note any kind of discoloration or any abnormalities. Say, for example, if they're more yellow in the conjunctiva area, it may be a sign of liver failure or jaundice. Okay? Alright, from there I'm going to turn off the light and test her pupils relating to light. Now they should dilate with the dark lighting, but flashing the light across should constrict the pupils. And even though I have the light on one pupil, both pupils should constrict together. And if they don't, that could be a sign of neuro impairment. Okay, I'm going to turn the light back on. Okay, if I can get you to follow the pen, we're going to do the 6 points of gaze. Now this is going to test cranial nerves 3, 4, and 6. If you'll watch it come into her eyes, notice the closing in and the constriction of the pupils. That should be noted. If it's not, that could also be a sign of neuro impairment. Okay. We're going to take a look at the ears after that. Just the external auditory meatus for any kind of lesions or discoloration. Any buildup of earwax that could disrupt hearing is another thing. And we would do that normally for both sides, but for time constraints. And we're going to do a hearing test actually called the whisper test. If I get you to put one finger inside this ear, and we'll yell out 3 numbers, or we'll whisper 3 numbers, and we'll try to get her to reciprocate them.
3, 4, 5.
Alright, that's correct, and we do it for the other ear as well, but for time constraints, we're going to kind of move along. Okay, from here we're going to check out her nose. We should see small, fine hairs and a dry membrane in there. That's a normal finding, and if you see any other kind of abnormal findings, basically anything else, that would be considered an abnormal finding. Okay, we look for symmetry as well. And basically, all facial symmetry is anything drooping eyeballs, nose, especially around the mouth. If any kind of drooping is noted, that's a sign of neuro impairment. Okay, take a look at your mouth real quick. And you just say ah, and stick your tongue straight out. That's testing cranial nerve number 12. Okay, we're going to take a look inside. The roof of the mouth should have no lesions. It should be pink and moist. The uvula and tonsils are visible. They should also be pink and moist without any kind of lesions or anything. Look at the bottom of the tongue. You should be able to see arteries and veins, and they should be very moist through that area. Okay. We'll press on the sinuses, the frontal sinuses and the maxillary. Note any kind of tenderness that's noted in those areas. Okay. We go from there to the neck. Look for any kind of deviation of the trachea, because that could be a sign of a life-threatening complication called tension pneumothorax. Okay, we're going to check the carotid pulses. Be sure and only check one at a time, because if you press on both of them, you could lose consciousness. Okay, and we're going to check the lymph nodes for any kind of tenderness or enlargement. Okay, we're going to go around to the back and we're going to go around the back and check the breathing. Okay, from here we can also check out the spine alignment as well. Notice any kind of lesions or cuts or anything out of the abnormal skin so far as normal ethnicity. No cuts and bruises or abrasions noted. Okay, we can start out with percussion. It's laying your hand out and tapping your middle finger with these two fingers. You should hear a dull, kind of hollow sound to it. And you always go from side to side and down to be able to get a good comparison of each lung field. Okay, and next we're going to listen to the lungs. Okay, if I can get you to take a deep breath for me. We do the same thing. We go side to side to get a good comparison of each lung. Then down. Alright, if I can get you to lay on back. That's good. Okay, we're just going to do a general inspection of the chest. Now, it is noted that it is red up here. But with her age and skin color, that's a normal finding. Okay, we do find these little skin tags underneath her diaphragm area. Those can be caused from abnormal rubbing of skin to skin or skin to clothing contact, and it's not a tumor or cancerous or anything. It's a pretty normal finding. About 25% of adults have it, so it's not a major concern right now. Okay, we'll look for any kind of lesions or abnormalities or any kind of old scars or anything through here. I'm gonna place my hand left of the sternum, see if there's any kind of heave, which could be a sign of hypertrophy. Okay. Then we're going to auscultate for heart murmurs. Going to go just right of the sternum for aortic, just left of the sternum for pulmonary, just below that for the tricuspid, and below down here for the mitral valve. I'm actually going to try to find the apical pulse, which is mid-clavicular of the 5th intercostal space, or generally right below the nipple. Alright, obese individuals, you may not be able to feel it, but it is the strongest point of the heart. Okay, we're going to listen to that. We're going to listen for the rate and rhythm and bounding of the pulse. Okay, from there we're going to check out the abdomen. Okay, we're going to just do an overall inspection of the abdomen at first, noting any kind of cuts or lesions or discoloration or bruising. Okay, first we're going to listen to the quadrants. We're going to go around in this motion to follow the same pattern of the colon. Now, she did mention she had a irritable bowel syndrome, which would be indicating of hyperactive bowel sounds. Okay, and hyperactive bowel sounds were noted. I'm going to start out with light palpation to find any kind of tenderness. Do you have any kind of tenderness?
No.
Okay, now we're going to try to palpate for the liver. Get you to take a deep breath for me. Just get right underneath that rib cage. Breathe out. We do the same thing under here for the spleen, underneath that rib cage. Then we're going to try for the left kidney. The same thing over here for the right kidney. Alright. After this, we're going to go through passive range of motion. We're going to do abduction, adduction, flexion, and extension of the shoulder, elbow, and the hand. Range of motion seems to be intact. Upper extremity, we're only going to use one side because of the time constraints, but we would do the same on the other arm as well. Now we're going to do the lower extremity. Okay. Same thing as with the other upper extremity. We would do both legs, but for time constraints. We're going to check out the pulses of the lower extremity. The posterior tibial is it's beside the malleolus, in between that and the Achilles tendon. Okay, you would note the strength, the rate, and the rhythm of the pulse. And then come over here, and you'll find this bone to the great toe. Go just laterally to that, but don't press too far. You'll crush close up the actual artery itself. Okay, you should note temperature and color of the lower extremities, and if there's any kind of edema down here, which she actually does not have. She looks good. Alright, let you come on up.
Thank you.
I'd like to thank her for letting me do this on her, and we are done with the assessment. Only teaching for the future is monitor diet and exercise. At her age, it's most important right now compared to any other time in her life. Thank you so much.